Here are two cylinders. Now they're virtually the same except for the orientation. I think of them of cans of soda. One is sitting on the counter and one fell over and is lying on the counter. Now the dotted lines on there are representative of two specific meridians. Meridian just means direction. So we have a vertical and a horizontal. Now I want you to imagine what the shape would do to light rays passing through it. The can on the left, the vertical meridian is represented by the lavender dashed line. So if you took a toothpick and you laid it up against that vertical meridian there, that lavender line, you would notice that all of the surface of the toothpick comes in contact with the can. In other words, the can is flat at that lavender line. And we know what a flat surface does to light. It does not verge it. It does nothing. In other words, it has no power. Now, still talking about the can on the left, the horizontal meridian in orange. If we were to cut this shape in half lengthwise and shine a light, like if it were transparent, and we shined a light on either side, either in front of it or behind it, so that the light rays pass through, what would it do to the light? Well, it would converge the light rays. We know this because we've been working with this particular shape, only we've been working with cross sections of spherical lenses. But it still will converge the light to a point. And I want you to keep in mind also that even though I've been drawing it this way, the light rays come to a point and continue on. They don't just stop right at that point and like cancel each other out or something. They continue on. So at one meridian, light rays would pass right through. They would slow down, but they wouldn't be bent. And at the other meridian, they would converge. The meridian that converges the light, we refer to as the power meridian because that has the power. That's represented in this picture with the dashed orange line, the power meridian. The lavender lines, the other meridian, is referred to as the axis meridian. So we have axis or power meridians. Now, the axis meridian and the power meridian are always going to be 90 degrees away from one another because you're always going to have a long side of the can and a short side of the can. You won't always have them oriented at 180 or 90 degrees. Sometimes your can will be, diagonal. So they may have different angle measurements, but they'll always be 90 degrees apart. So when we refer to these directions or meridians, we start with 0, which is going to be on the patient's left side, regardless of whether we're talking about their left or right eye. 0 is always on the patient's left, and then we go counterclockwise around to the 180 position. Now, we're used to looking at something like this and understanding that this is a lens that's converging light rays to a point. But when we're talking about this type of lens, we've been talking about spherical lenses, okay? Now we're going to discuss cylindrical lenses. The spherical lens, if you sliced a section off to make a lens, it would have the same Burgess power all the way around at 360 degrees, but not so with a cylindrical lens. With a cylindrical lens, it's going to depend on where your ray of light comes in. And in reality, we're going to have light rays coming in all directions. So what will happen is, instead of the light all converging to a single point, we're going to have planes of light that converge to a line, something like this. It's kind of hard to draw in a 2D representation for a 3D occurrence, but hopefully you can understand this picture. And here's that same picture looking from top down. And where we have that red arrow, instead of a focal point this time like we've been doing with spheres, that's going to be a focal line. If your can is sitting on the counter, that focal line is going to be vertical, and if it's lying on the counter, it's going to be horizontal. Okay, we're going to talk about eyes for a second. Then we're going to go back to the lenses, but I just want you to keep in mind what these types of lenses do, because your eye also refracts light. And if your eye is not spherical and refracting spherically, it's going to do something more like what it's doing with the cylinders. And that's called astigmatism. An astigmatic eye you'll often hear referred to in terms of a football. Instead of being spherical like a basketball, the globe of the eye is shaped more like a football. Now, the first two common types of astigmatism that we're going to talk about are with the rule and against the rule. In terms of football, we can refer to them as the passing eye and the punting eye. Now, with the rule, passing is generally seen more with children, and the punting with more elderly patients, generally. So how do you correct something like that? With cylinder. Okay, you get the idea. If the eye is too steep one way, we add steepness in the opposite meridian, 90 degrees away, to correct it and sort of try to make the eye focus more like a sphere. Well, we don't really use the cylinder, we use a torus shape, which looks like this, a pool floaty or an inner tube. That's where we get the word toric from. And a section of this torus is sliced off and used as a lens. This is called a spherocylindrical lens. The spherocylindrical lens works in similar ways to the cylindrical lens with one major difference. This would be like a cylinder, a can, sitting on the counter, in which case the vertical meridian of that cylinder would be flat. It would not converge light. Our spherocylindrical lens does not have that vertical meridian flat. It is flatter, but it's curved, which means it does converge light. It's not going to converge it to a point, it's going to converge it to a line. And the horizontal meridian, which is not horizontal in this picture because in order to give you a better view, I had to take that upright can and put it on its side. But at any rate, the narrower aspect of the lens will have the steeper curve, and of course, having a steeper curve, it'll have a shorter focal length as well. Now, what we have in this picture as a vertical meridian will have a horizontal focal line. And the horizontal in this picture, which is no longer lying on its side, I put it back to where it should be, the horizontal will create a vertical focal line. So we no longer have our spherical lens, which focuses light to a single point. Now we have a spherocylindrical lens that focuses light to two focal lines, one vertical and one horizontal, provided we have our can upright on the counter. But either way, they're going to be 90 degrees from one another and two focal lines. This is also similar to what our astigmatic eye might do, because the eye really isn't shaped like a cylinder. It's shaped more like this, like a spherocylinder, if it's astigmatic. In this section right here, from focal line to focal line, is called the interval of Sturm. And right here, in the center, is called the circle of least confusion. And I'm going to explain what that means. If you were to take a tube or roll up a piece of paper and smush both ends, one horizontally and one vertically, and then you were to take cross sections all the way along the length, and look through them, you might get something that looks something like this. And right in the center there would be something called the circle of least confusion, which is the area of least distortion. And in my diagram, it's right about here. And again, that's where you'd have the least distortion. And to find out where that is, you just take the spherical power and you add half of the cylinder power, and that will get you the length of the, that will get you right to that circle of least confusion. There's a formula for this, but the formula seems so much more confusing than just remembering take the sphere power and half the cylinder power. If you remember, in an eye that is non-astigmatic but is myopic, light rays come to a point focus somewhere in the vitreous, somewhere before the retina. And then they continue on, but they continue on spread apart. So once they hit the retina, they are spread apart and blurry. And in a hyperopic eye, light rays come to a point focus beyond the retina. It's a virtual point focus because it's not really there. But what hits the retina is not a point focus. They're still spread apart. So again, that's why it's blurry. Now in an astigmatic eye, light rays form two focal lines. I want to discuss 5 basic types of astigmatism. In simple astigmatisms, one focal line is on the retina. In simple myopic, one's on the retina and one's in front of the retina, somewhere in the vitreous. In simple hyperopic astigmatism, one focal line is on the retina and one is focused somewhere behind the retina. In compound myopic, both focal lines are in front of the retina. And in compound hyperopic, of course, they're both behind the retina. And then you can also have something called mixed astigmatism. In mixed astigmatism, one is in front of the retina and one is behind the retina. Okay, that's all I'm going to say in this video because I got a couple more in the works and I don't want to do too much in one. So thanks for watching.